At first, the patient position the patient in head first supine and place a body coil over the pelvis so that the upper part of the coil is over the iliac crest and the lower border of the coil is below the symphysis pubis, and center at the midline of the coil, and give headphone to the patient to reduce sound. And now go to the console and enter the patient name by using patient register, and then click the exam, and from the exam click from the pelvis, select the pelvis new here that is saved as pelvis new, and drag the protocol to the exam list. And now localizer scan is running, and localizer will give us 3 images for planning. Now it's scanning. Localizer takes less time to scan. So I am deleting some extra protocols, and there are the post contrast protocols. If I take post contrast sequence, so now the localizer images have appeared, and I am planning for T2 sagittal first, and for this I am planning over the coronal and axial image, and make sure that the slices are parallel to the spinal cord and goes to at the midline or the symphysis pubis, and place a saturation band over the box. And now I am planning for coronal. So for coronal I have to plan on the proper T2 sagittal image. So T2 sagittal scan have been complete. Now I will drag the image to the exam card and I will plan over this. So for coronal I am planning on the sagittal over the sagittal image that have scanned, and I will increase the field of view to 320 and reduce the slice to 24, and slice thickness is 5, and make sure that the whole pelvis up to the iliac crest and up to bottom is to the below the symphysis pubis, and try to include the penis and testes in case of male patient. And T2 team coronal have been planned, and now T1 coronal protocol open, and just copy the parameter from the previous T2 team coronal, copy the slice and saturation region, and you will see that the same planning is shown as before. And now apply, and now remains 3 transverse sequence: T2 transverse, T2 team transverse, and T1 transverse. So now I am planning for T2 transverse. So for this I have to plan on the sagittal and coronal image. You can see that the slice thickness is 5 here, and plan the slices parallel to the iliac bone or parallel to the hip joint, and make sure that the slices covered from upper part of the iliac crest and to the lower below the symphysis pubis, and try to include the testes, and then click apply. And now copy the slice and saturation for the rest of the transverse sequence, and then just click apply. And for T1 transverse, copy the slice and saturation again and click OK. You don't need to plan again for the rest of the transverse, just copy the plan from the previous transverse. Now all my pre-contrast protocols have been planned, and they will scan one by one. And there is three post contrast protocols that I took. So let's see, is have I used the contrast. So now is the T2 sagittal. That's the first scan have done. So I will print it out, and for this select the series from the viewing and send it to the filming. And now I am in the filming. Select the folder and change the layout to 5 into 5. So there is 25 sagittal images, T2 sagittal. So why it's T2? You can see that we know that in T2 sequence fluid is bright. So you can see that the urine in the bladder is bright, and also the CSF in the spinal cord also bright. So always first look for the fluid if you want to identify the sequence T2 or T1. Now it's complete this film and print out. So now T1 coronal is running. T2 team coronal has been completed. So I will see this. So the first one is the in the left side. Sorry, on the on the left side is the T2 STR coronal, and on the right side is the T1 coronal. So in this image you can see there is a lesion in the femoral neck, the right femoral head. So I am rotating the image to the right so that the images are straight enough, and I have select two series together and send them to the filming. So I want to film together T2 team coronal and T1 coronal. For this I am changing the layout to 4 into 6. That means 24 coronal images will be filmed in the film. So there is two coronal film. One is T2 team coronal and another is T1 coronal that I have taken for this MRI pelvis. And now I have to remove all the not all the parameters from the box. I will keep some parameters in the box as text and adjust the window. Adjust the window or contrast of the image so that it's not so bright or so dark, and also adjust the T1 coronal film. So it was very bright. I reduce the contrast. So two coronal film have been prepared, and I am printing out by clicking expose film tags. Expose film tags. So now all the protocols have been scanned, and here you can see the T2 transverse, and this is T2 STR transverse. This is T2 STR transverse that I am scrolling, and here is the lesion from the femoral head, and this is the T1 contrast. Sorry, this is a T1 transverse protocol. Now I am selecting this T2 transverse series and send it to the filming for printing, and also find the reference image and also send the reference image to the filming. Now go to filming and change the layout to 4 into 7 so that 28 image including reference image can be fitted in the film. So there is extra 2 images I have to delete, extra 3 images I have to delete 3 images to put the reference image. And now zoom in the image so that it fills up to the segments. So in this case, I am not using a contrast. So as doctor advised non-contrast MRI pelvis, but there is a lesion in the right femoral head. So contrast should be used in this case, but doctor didn't advise. The doctor advised non-contrast. Maybe there is problem of the kidney of the patient. So if you use contrast for pelvis, for post contrast protocols are T1 sagittal fat set, T1 transverse fat set, and T1 coronal fat set. So all the protocols are T1 and all the protocols are fat set. Just only changes is the plane, axial, coronal, and sagittal. So that's the rules for all contrast post contrast protocols except brain. For MRI brain, you have to take normal T1 sequence, but in another cases like joints and uh, extremities, the pelvis, neck, in this case you have to take T1 fat set for post contrast. So now I am preparing T1 transverse images in 4 into 7 layout. For transverse, the 4 into 7 means that there is 28 images including the reference image will be fitted in the film, and these are the transverse film that I am making. So I think this is the last sequence that I have to T1 transverse. This is the last sequence. So adjust the contrast and print out. So hope you enjoyed the video. Please hit the like button and don't forget to subscribe my YouTube channel, and also click the bell icon. Thank you.